Okay, so how do we treat pain in general? We talked about the more kind of deeper level with organ imbalances, but now somebody's just come in and they've got a dodgy neck. So how does that work with those other diagnostics that we talked about? So pain is basically a blockage within a particular channel. So channels run through the body. There are 12 different channels. There are some other more internal channels, but that's all getting a little bit too deep. So the kind of 12 more superficial channels relate to those 12 organs that we talked about in five element theory. So patients pointing to their neck and they're saying this hurts. So I've got to think, okay, which channels run through the neck? And I kind of look at that location and I think, okay, I know which channel is affected. Now, why do they feel pain from a Chinese medical point of view? Pain is because that channel is blocked, so that qi cannot get through. So it's blocked by something. Now, it can either be blocked by bruising, or it can be blocked by inflammation, or it can be blocked by cold. There's many different things that could cause that blockage. And acupuncturists also need to figure out what's causing that blockage. If it's something on a more internal level, we might need to talk about kind of lifestyle advice, or if there's kind of an external kind of pathogen that's come in, which can often be the case with necks. If you're out in the cold weather, that can cause you some neck pain. So we've really got to kind of drill that down and figure out where that's coming from. So once we know which channel is affected, we know there's pain. We know that we need to push that qi through that channel and clear that blockage. So that's how we're able to get patients kind of pain-free using needles. Now, the style of acupuncture I use doesn't mean that I put a needle into the neck to treat neck pain. We like to do it a whole lot more clever than that. So I then look at which channels will balance that other channel. So looking at that past kind of five element theory, and figuring out, okay, well, how do I best balance that channel? Which other organs do I call on to help me here? So I then do a little mathematical equation in my head, figure out which other channel is going to be the best one, and I use that. So often for a neck, I will use a point on the ankle. And you're probably thinking, come on, like that can't work. If you're a patient of mine, then you absolutely know it does work because we do it all the time. But it really does work. You stick a needle in their ankle. At a particular point, obviously know where I'm putting the needle, and I'm not just randomly sticking them in needles, and I get them to turn their heads and the pain goes. So that is a very simple way of how we're able to treat pain. Pain is quite an easy one in a way. When a patient comes in and they say, oh, yeah, I've just got a sore neck, I'm thinking, brilliant, this is going to be really easy to do. It's when there's more internal kind of organ issues that are out of balance, and hormones are often very difficult to treat, but we can treat them with Chinese medicine quite effectively. That's probably slightly heavier, so we won't talk about that too much here, but it does just kind of link back in with the whole yin-yang theory. Is it the qi that's having an issue? So is there pain? That's because the yang kind of can't get through, the qi can't get through. If there's an issue with, say, periods, that's more of a kind of blood, more of a yin issue. So we would then look at the yin. So this is another way of kind of deciding, is it yang? Is it yin? Is there pain? Is the yang blocked? Or is it yin? Is it more down to blood and fluids? So next we will talk about how I decide which points I'm going to choose.